We're working as hard and as fast as we can to get on top of the outbreak here in Shepparton at the moment. We've made some really good progress in the last 24 hours. We've got a lot better handle on the exposure sites that are now starting to become published on the department's website. We're really grateful for the support we've received from GV Health staff, a number of other service providers across Victoria, including Rural Health Services, the Department of Health, private providers that are coming in to help us out with testing as well. I'd also like to thank and acknowledge the community members some of who have waited for long periods of time for testing that's available. We are trying our best to increase the resources there as well. At the moment there is 23 positive cases that relate to this outbreak. We've got the family groupings plus some additional associates and friendship groups related to those initial people who tested positive. In regards to testing, we've got 3 drive-through locations plus the acute respiratory clinic here in Shepparton that's open. We've made additional requests for resources yesterday and again today. I'm pleased to advise that we will be able to open an additional drive-through testing site tomorrow. We expect at this stage that will be in Mooroopna, and we'll provide more information on our Facebook page and website later on this afternoon once those details are confirmed. Yesterday there was in terms of the sites that GV Health is coordinating and providing testing services for and at, there was over 2,400 tests that we conducted at those locations. There's also additional testing being undertaken at other locations in Shepparton as well. So 2,400 is a good result. Today I think it will be in the order of around 3,000, possibly more people that we will test. The challenge we're faced with at the moment is that we anticipate at this stage probably in the order of 10,000 or more people that we are going to have to test in relation to this outbreak. That's because largely there's big numbers of students involved at the school locations that have been published, particularly around Greater Shepparton Secondary College campuses, St Mel's and Orvale Primary School as well. So a large number of not only students and staff at those schools, but in particular their household contacts that also require testing as well. So around about 10 to 11,000 people is a large number of people. As I mentioned, we'll have some additional sites helping out with that tomorrow. What's happening today is those sites that we already have open will work back late. They're doing a terrific job in trying to work as quickly as they can to provide that testing response. So happy to take any questions.
Do you know what time they're looking at opening up till tonight?
Will be at least until 6 o'clock across those locations. There will have to be the need though to effectively, in the not too distant future, close the gates in order to be able to get through the people that are already in the queue.
Can you talk a bit more about these new cases? It's still 3 households?
The involvement of certainly the family members, there's still the 3 households. There's another close family group, and then there's some additional students that are related to some of the cases that have tested positive, not related in terms of a familial relationship, but a school-based association, and that's where we're starting to see some positive cases now.
Do you have any more information about where the first case contracted COVID?
Pardon, could you just repeat that please?
Do you have any more information about where the first case contracted COVID?
No, the contact tracing process is continuing in regard to being able to identify the index case, and that work is still underway.
Will those testing sites, say, set up for the 14 days for those Tier 1 people to test again? Do you expect sort of the same influx at the end of their 14-day isolation as we've had day 1?
There will be the need to test some of those people again. At this stage, the priority testing that we're doing with certain year levels at some of the schools, for example, will give us a better idea about what the follow-up testing will be at day 13, for example, and other times during the coming days. We expect there will be high numbers, I anticipate that, but we should be able to stagger that a little bit more rather than the big influx that we're dealing with at the moment.
The Invergordon campus is now an exposure site. Can you tell me more about that?
The Maguire campus.
Invergordon?
Invergordon. So that's in relation to, again, another smaller campus, as I understand it, of Greater Shepparton Secondary College. So there's additional precautions being taken in relation to that campus of the college.
How many people are currently in isolation?
There would be at least a couple of thousand at this stage. We're still tallying up the information in regards to the primary close contacts. The focus of the contact tracing team has been to complete the initial interviews for the families that we know where we have positive cases, and then start to work through the primary close contacts and their household members as well.
With long wait times at testing sites, are you expecting to open more testing sites in coming days?
Yeah, so as I said, I acknowledge that there has been long wait times. I'm aware that there's waits of up to possibly up to 3 hours at certain sites. Periodically we have had to close access to those sites simply from a traffic management and a safety perspective. Today we've opened, on Saturday we had 2 drive-through sites plus our respiratory clinic here at Graham Street. Today we opened an additional drive-through testing site at the Shepparton Showgrounds, and tomorrow we are anticipating opening a 4th drive-through site somewhere in Mooroopna, and we're just finalising the details of that venue at this stage. All of the information about where those testing sites are, opening times, etc. will be placed on our Facebook page later this afternoon.
What support have you received from other health services?
We've been really fortunate. So the testing site at the harness racing complex is largely being operated by Barwon Health. We've had today, to enable us to open the site at the Shepparton Showgrounds, the testing site there, we've had support from Barwon Health and health services in and around Colac and the southwest of the region. We've also had, through the Department of Health Central Rapid Response Testing Team, some support from private providers that the Department of Health have contract arrangements with. So it really is a team effort, and that's something that in these sorts of circumstances you need everybody to pull together, and we're really grateful that that's occurred.
So with the numbers of people, I guess, that are having to isolate, including GV health staff because they've had contacts, the children's go to the schools, etc. How's that affected testing sites and things like that? Is that taking big numbers out of those?
So simply because there's a large number of people at schools, so obviously the students and then the staff as well, that's contributed to the rapid rise in the number of people that have needed to be tested. Probably now we're also seeing that there's some supermarkets and shopping centres that are becoming listed as exposure sites, and that's going to be, again, high volume people, places that have high volumes of people in them. So as I said before, we're anticipating in the order at this stage 10 to 11,000 people that are going to need to be tested. It could well be higher than that in coming days, but we're trying to gear up and have additional testing resources in order to be able to cope with that demand.
With the schools being affected, has there been any thoughts to whether it's going to affect the bus services, like potential exposure through the bus network of town?
That's something that is actively being pursued at the moment in relation to, we know in regards to bus routes and exchanges and places where students are hopping on and off certain buses, I know that's something that the contact tracing team are focusing on at the moment, and as soon as they start to get further details and complete their interviews and understand the movement of students and what bus routes and how there might be overlap, we'll be posting exposure site information in relation to that if we need to.
What preparations are being made by GV Health in the expectation that there probably will be COVID patients in the hospital, given the numbers we're already seeing of people affected?
We've already implemented, so since over recent weeks and ever since the pandemic began, really. We've already been operating at a heightened sense of alertness. We've got a series of plans to respond to changing circumstances. As soon as we became aware that there was a positive case on Friday morning, we implemented some of the subsequent stages of those plans. What that means is a lot of the staff have moved to higher levels of personal protective equipment in terms of masks and face shields and gowns and things like that we've implemented right across our sites. So we've got those plans in place. At the moment we have over 150 staff that are furloughed in relation to the outbreak and the exposure sites that are listed. We're working hard to redirect people across different parts of our service to what we consider at this moment to be our critical services, such as our emergency department and other acute hospital-based services, and testing, of course. We're really working through the numbers of staff that will be furloughed. We expect that's probably going to get a bit higher overnight and into tomorrow, but we are absolutely focused on making sure we have the priority areas staffed and continue to operate in coming days.
Are you starting to set up any wards for COVID-specific patients or anything like that?
We already have designated parts of our emergency department and a designated respiratory ward that's been in place since the pandemic began. Those approaches and practices have been in place for a number of months now and will continue until we get on top of the pandemic.
And lastly, any message to the community, many of whom are in isolation?
So please, for any members of the community, there's the best place that people can find information, frequently asked questions, testing sites, advice about Tier 1 exposure sites, Tier 2 sites. What that all means is the Department of Health's website. It is the single source of truth. We refer all of our people to that place. So for community members, it is the best spot to find information, and that's coronavirus.vic.gov.au. And there's also a separate telephone number, 1800 675 398, that people can contact as well. We're really encouraging anybody who has a query to go to those two places. Our switchboard and other parts of our organisation are becoming a little bit overwhelmed with questions that people can find the answers to those questions in those locations. So please, that would be terrific if people could direct those inquiries to those locations. But going back to the message to the community and people at home, we know this is tough. It's a difficult time with everybody being a little bit weary in relation to the pandemic, and we appreciate that. Please take care of yourselves and each other, and as I said before, acknowledge there has been some delays at the testing sites, but I do thank everybody for their patience and goodwill in being prepared to stick with us and the whole system while we increase our testing capacity and better understand what's happening with the outbreak.